Good evening, everyone. Today we are going to learn about the history taking. History taking is very important in the starting clinical classes or when your clinical ward shifting has been started. Our clinical classes has been started. The history taking is the first and very important. So today we are going to learn about the history taking. So first of all, the first point of the history taking is particulars of the patient. The particulars of the patient includes the name, age, sex, religion, social status, occupation, residence, date of admission and date of examination. The points are very important because according to the age, sex, religion, social status, occupation, residence, various disease occurs. For example, for like social status in high class people, appendix is very common, and in low class people, tuberculosis is common. Likewise, the second point in the history taking is chief complaints with duration. Chief complaints with duration is actually all about the what problem the patient has come to you. It should be in the patient language, and a good clinician or a doctor should all listen carefully to the all what the patient says to him and should be recorded here with duration. And the third point is history of present illness. Then the points that the patient has told him in the chief complaints, the doctor should elaborate and ask him about details about the complaints. And history of past illness, it includes that history of past illness includes any illness or a disease that he has before this illness or disease for which he has come. Like it can be like diabetes mellitus, hypertension, which he may have before. Then it comes up. Then the fifth point is drug history. If the clinician or the doctor should ask about any drug that he is taking or he has taken for the symptoms. The sixth point is family history. A doctor should ask about the disease that he has or the symptoms that he has is there previously in his family or not. Like diabetes mellitus, it has genetic predisposition. So if anybody's father or mother is diabetic, then there is chance that the son or daughter may get diabetes mellitus. The seventh point is personal history. Personal history includes about how he eats, what he is a smoker or does he takes alcohol, and so on. Then the eighth point is socio-economic history. Social status and economic status of the patient is recorded. The ninth is immunization history. Immunization history is all about the vaccines or he has taken before. 10th point is menstrual history, which should be taken in case of female and is very important. Then we come to examination. Examination are of two types, that is general examination and systemic examination. In beginning, we should note that in general examination there are altogether 24 points, which our professors or teachers ask us in examination, and we should remember all that points. There is very easy way to remember it, and 1 minute you can remember that all. The first point is appearance. Then how he is looking, built. Built means is he obese or he is underweight, and so on. Nutrition means is he adequate nutrition it takes to get nutrition or he is on poor diet. Fourth point is cooperation. How he talks to you or how he behaves. Fourth point. Now fifth point is decubitus. Means when you enter or first seen the patient, then how his position was. He was sitting or lying or which position. Then sixth point is anemia, then jaundice, then cyanosis, then cloving, and polynychia, echinacea, edema, dehydration, pigmentation of the skin, then lips, tongue, oral mucosa, nose, lymph node, thyroid gland, breast to see gynecomastia or lipomastia. Body hair distribution, neck veins, pulse, blood pressure, temperature, and respiratory rate. So these are the 24 points. And for remembering it, we can go like this: A, B, C, D. A for appearance, B for body build. With body build, you can add nutrition. And C for cooperation, D for decubitous. Now we can come through examination from head to toe. From head means from eyes you can see anemia, then jaundice, then from eyes now let's come to tongue. In tongue you can see cyanosis. Then come to your hands. In hand you can see clogging, cholinergia, leukonergia. And let's go to the foot. In the medial areas you can see edema, and the internal body like symptoms you can see dehydration and pigmentation. Now there are some points you should remember, like now lips, tongue, oral mucosa, nose, then lymph node, then again in neck you can see lymph node and thyroid gland, and then come to breast for gynecomastia or lipomastia and body hair distribution. Then in neck also you can see neck veins, and last 4 point is pulse, blood pressure, temperature, and respiratory rate. These are the vital signs. So here you get 5. Here you got 4. Total it already 9. Then AJCC in the AJC in the mouth, and this in the CKL in the hand, and leg edema. With edema then you can see in the skin dehydration and pigmentation. Then you can go again in the lips, tongue, oral mucosa. Then in the neck you can come like lymph node, thyroid, then breast, then body hair distribution, then neck veins. Then after neck veins you can come to 4 vital signs: pulse, BP, temperature, respiratory rate. So this is all about general examination. Then after general examination we go for systemic examination. In systemic examination we see various systems. First, according to the patient symptoms, we go for first for that system, then for other systems. Like we go for gastrointestinal system, respiratory system, cardiovascular system, neurological system, musculoskeletal system, genitourinary system, and so on. Now our next point is salient feature. In salient feature, here we summarize all the findings from above 11 points, and we write it in our doctor's language. Scientific words or medical terms are used in salient features. Then we can go for next point, that is provisional diagnosis. From our examinations and clinical knowledge, we give provisional diagnosis that what may be the cause, what may be the disease behind these symptoms. And we go for the next point, that is differential diagnosis. In differential diagnosis we give the related disease that may cause the above symptoms. That is provisional diagnosis are single, that is one disease. Then in differential diagnosis maybe 2, 3, but the less the differential diagnosis, the more you are a good clinician. But it doesn't mean that you should not give other differential diagnosis. There may be 2 or 3 differential diagnosis. So to make confirm that what's the pathology or what's the disease causing the symptoms, we prescribe some investigation. There's some routine investigation and then diagnostic investigations, and from the report then we give clinical diagnosis, and according this clinical diagnosis we proceed for treatment. And after treatment we follow up the patient to find whether he has completely recovered and is well now. And these are the points of the history taking. There are some points which are not concerned in this topic, but I want to say it because it's very important. And this is while examination. While examination, you should first consult the patient. That is, we should tell him what we are going to do, what about the procedures we are going to follow, and take consent from the patient to proceed. Then we should give him proper privacy. Then there must be an attendant if the patient is female, and the attendant must be a female. That may be nurse or family member of the patient, female family member of the patient. Then we should give him environmental comfort. That means if it is winter days, the examination room should be in appropriate temperature by a heater and so on. And there should be instruments and equipments ready for all the instruments and equipments that are required for the examination should be ready, like gloves, any other instruments. For example, in case of rectal examination, there must be gloves, there must be cotton swabs, there must be jelly with an anesthetic, then there must be proctoscope, sigmoidoscope, and so on. And then finally we proceed for examination. So thank you everyone. Hope you like the video, and if you like the video, please like the video and subscribe the channel. And if you want any video on any topic, any medical topic, then comment in comment section. Thank you.